Hello, I'm Dale Brockman. I'm a physical therapist from Gateway Rehab Hospital, and today I wanted to talk to you about some common shoulder involvements. The one that we'll talk about specifically is an impingement syndrome. To know how the impingement syndrome works, it's most helpful if you know what the anatomy looks like in the shoulder. So I thought I'd show you a little view of the anatomy. This is the humerus bone. This is a view of the shoulder blade. We call that the scapula from an inside view. So you can see it kind of has some funny borders here. It comes all the way around. This particular spot of the bone is called the acromion, and it's what sits over top of our humerus. The important thing to note here is there's only so much space between the acromion and the head of the humerus. There are important structures that sit in that space, including the rotator cuff tendons, the bicipital tendon, and also one bursa. A bursa is like a water balloon. It helps to decrease friction. So the subacromial, meaning below the acromion, bursa sits in that region. As we can tell from this picture, when the arm is in a down position, when the elbow is by your side, there's a decent amount of space available in that region. What happens is when the arm is lifted outward or upward, the amount of space between the head of the humerus, the top of the humerus, and the acromion becomes smaller. And as a result, things that are sitting in that region can become pinched. In a normal anatomy situation, there's plenty of space available, but there are things that can crowd that area, including arthritis of the AC joint. But also, if a person has poor posture, if a person's posture is forward, it tends to bring the acromion forward and limits the space for the tendons to breathe. So the important thing that has to happen in a physical therapy evaluation is the person evaluating the patient needs to determine if there are postural abnormalities, if there are limitations of joint capsule flexibility, if we have certain muscles that are stronger than others, which is called a muscle imbalance. We have to determine those things during the evaluation. And as we do that, we can then prescribe a program that would be specific to that person's needs. The rotator cuff actually has 4 muscles, and those 4 muscles produce 3 types of movements. They elevate the shoulder, that's the first one. External rotation is accomplished by 2 of the muscles, and internal rotation by the 4th. So there's 3 different movements that occur with the rotator cuff muscles. But the 4th thing that the rotator cuff does that's very important is it stabilizes the head of the humerus. So it pulls it into the joint nice and snug so that it's not flopping around pinching tendons. So we have to keep that all in mind as we're developing a program for this patient. And as we get the cuff working more properly, what happens then is there's less of a chance for pinching that tendon, and then inflammation can calm and the person can get back to a normal, healthy lifestyle.